Before performing endovenous thermal ablation, the skin and surrounding tissues are numbed. The proceduralist makes a small cut in the skin, into which he or she inserts a very thin tube called a catheter. The catheter is guided into the vein to be treated using ultrasound imaging. The proceduralist applies radiofrequency or laser energy to the enlarged vein through the catheter's tip. As the catheter is pulled out, the heat causes the vein to collapse and eventually heal shut. The blood will then reroute through other veins.
Diagnosed as a varicose vein, C2 classification. Now we are going to do microwave energy, microwave ablation. So ultrasound guided endoluminal GSV, microwave new energy, we are going to do ablation. So the microwave is a, everybody is surprised to use in the varicose veins. And the microwave used in ovens, you can heat the food, prepare the food. But this same energy we are using in the varicose veins. It is superior than the laser, and you can see this echo from China company. And the what this is a fiber. You can use, there is a 1 centimeter marking, same like a laser. So this is a what you call laser and is measure. Measure is magnetron inside, gives infrared and the electromagnetic wavelength. So from their active tip, it releases electromagnetic waves. They are called microwaves. So it acts on the hydrogen atom H2O on the cells of inner layer of the tunica intima and it occludes. So the temperature when it is firing only 85, it cannot cross the 85 temperature. So the occlusion is very 100%, and the blasting veins, perforation veins not occur, very painless also. So and transmural death of the cells compared to the laser, you have the transmural death. So recurrence is a very minimal, no recurrence. Okay, the future energy is the microwave. Right. This is the antenna, we call antenna microwave, and it is a 5 French antenna. This is a 6 French sheath. We are introducing the vein. So see the length, you can marking outside. So the length of the saphenofemoral junction to the sheath, where introduce a sheath. So we are marking. So from this marking, we are introducing the vein. See that's. You stop this. Lighting లేదు కదా మొత్తం చీకటిగా ఉంది.
లైట్ ఉంటే అది కనబడుతుంది, డల్ చేస్తే అది కనబడదు.
Okay, there's an advantage of microwave machine. You have the tumescent pump. It is a peristaltic pump, so we can use a tumescent connectivity. It is a combination, so no need special instruments. So this will give with the tumescent anesthesia. Okay, right. Sodium bicarbonate 2 units and saline for tumescent anesthesia. Heavy obesity patient because of fat, saphenofemoral junction, that is Mickey Mouse signs. It's not so much clarity. Still, we are away from 2 centimeters. So this is saphenofemoral junction. So this is a deep vein femoral vein. This is long saphenous vein. So this is a junction. We are away from the 2 to 3 centimeters, right? Yeah, this is the fiber. for, okay, it's away 2 centimeter away from femoral junction. Now same Tumcent full injection pump. See, we are giving Tumcent. We have to go. So the advantage Tumcent, it's compress the vein diameter and it protect the surrounding tissue. You can do surrounding to 360 degrees and the most posterior and anterior. Okay. Pause. Or stop. Energy. So we are delivering energy. Setting of the venous ablation, the 40 watts, 6 seconds per 1 centimeter. So we have to give 2 cycle approximately. Then if more than 1 centimeter diameter, you can increase the energy. So this is a simple setting. So you can see how the ablation is going on. Now you can see the firing is going on, zooming, zoom, 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 zoom is going on. The antenna, it's moving. I'm giving firing. You can observe the white gasification, micro bubbling. There is a firing going on. So we are giving 1 centimeter, 6 seconds, 40 watts. This is a widely proposed watts and energy. Zoom there. So the newer treatment, minimal invasive and more tortuous dilated fourth class, like a SIP classification, stage 3, 4. It's more advantage, less recurrence, a new good energy microwave. It's going to replace laser in future. So this is the endovenous microwave ablation of varicose veins. So under ultrasound guided percutaneous, right? Thank you. Right. Good. Tumcent Anjesh. Saline. Saline.
If it is straight, you can take. Okay. It is tortuous, you cannot. And this, you cannot take. Saphenous nerve will be there. You can do it from here ablated, but you need to dissection. You cannot go because tortuous are there. You cannot negotiate it from up to here. But some cases, straight cases, connection is straight, the vein is straight, without tortuous, you can take from here. It's easy. But when you ablate, you cannot ablate because there is a saphenous nerve. So lifelong numbness, pain.
Paresthesia would remain.
Yeah. So you have to, by hydro dissection, you have to do. But
Away from the
so you have to show me saphenofemoral junction. He is a radiologist, you know. So we need a team.
Good morning, sir.
Yeah. This is the 6 French.
Yes, sir.
This is 6 French. Where is your yogas?
Yes, sir.
This what is this French? 6 French?
6 French, yes, sir.
6 French.
So can you check the chemical too?
Yeah, flow. Wait. So this, wait. This is the microwave antenna. You know the antenna? Old and TV, you have the antenna all over there. But why these people they called antenna, I don't know. Huh? You heard that antenna? Old and TV. Doordarshan, DD News.
Yes.
Huh? So this is a soft, flexible microwave antenna. Yesterday, a different antenna you can see. This antenna works for laser varicose veins and perianal fistula. Fistula also you can do with this, right? And you can see this is a block is a entry tip. You know? What is the white Vegas? What is the size of this?
Upward 1.7 centimeter.
How much?
1.7.
1.7.
To white one.
This is a active tip.
No, that will not.
Only
Only
of white one.
White one. Yeah, 1.1. Only 1.7 mm.
7 centimeter.
Yeah, this is active tip. Yeah,
It's only active.
right. 17 mm means how much? No,
7 centimeter.
Yeah. So we'll check the heat first. Gauss, please saline gauss. Commission ready कर लो.
So you is ready.
Yeah.
This place the food paddle and you check the flow, sir.
No, flow okay, but without flow it works, should work.
You have to.
No need. No, I'm not checking this.
Okay.
Taking
You have to check this. Wait.
40 watts is all. How much protocol is 40 watts. 40 watts.
Below knee.
Yeah, below.
Above.
Above knee the 55.
No, we'll see. Okay. थोड़ा इधर रखो. Right. 55. You want to do? Okay. Start. So you are selected here. Fourth.
Very first vein first.
First. Right. Now it is 40. You can do 50. You can do 50. Make it 50. Right. Now
Micro is on.
the deep vein. I have this is my driver. Try to understand. So I want 2 centimeter away means how to do the 2 centimeter away. So you can have a 2 centimeter. One mark. 1, 2.
Hold the sheet.
Yeah.
Sheet is coming out.
Okay. All right. You see, this is the junction. This junction is here. So he will show you. Yeah. This is the junction. You can see the walls over there. Sapulofemoral junction wall. No,
Yes.
It is classically showing. It's a good case. Yes, that's wall. So that junction.
Sapulofemoral junction. Sapinous vein and femoral vein. Both are.
Right? Spinal lady 23. Leave it 23.
This is a
23.
this is wall.
Okay. See, this is a technical, doesn't require to learn you. Thing is, what are the difference you have to learn? What is the superiority, what is the evidence based, what are the things you have to learn, how to convince her. So the same machine, since yesterday, one hospital, one machine, many diseases were treating. Many diseases were treating. That is the advantage. That is the beauty of the eco microwave. You understand? This motto you have to work. Right? And we are doing now fistula, then lipomas, then the liver, thyroid, breast fibroids. So all the department were coming same machine means that you keep in mind. Okay? Now what I am going to do is I am just doing tumescent anesthesia. This is a vein, this is a fiber. I will give a collapse it, pouring saline here. This is called tumescent anesthesia. It's a prepared technique. थोड़ा इधर ला लो. Anesthesia कर दिया?
Yes, sir.
Karnakar, take the video how to this tumescent ablated. You can see white lines, white gasification. Huh?
Yes, sir.
You can make out now clearly, saline.
Once the vein is ablated, if you do the ultrasound, you're gonna find out a white color over there in the ultrasound. That is what the calcification of the vein. Means vein is ablated. The ablation has been initiated. Within 21 to 28 days, the vein would be completely closed.
Sir, if varicose vein is not at all treated, that vein
Come.
And there is no relation between varicose vein and adult.
not at all.
Sometimes thrombus formation is there. It's migrate. Not at all. Superficial thrombophlebitis. That is going to DVT, DVT heart.
When a thrombus will be formed, then there might be.
Why? Because my grandfather,
Yeah.
he worked as a teacher. So
Yeah.
when before independence.
Oh.
So he passed away in 1987. So when I am very small, so when he was washing the
Obviously, you will be small.
pardon? No, so he was
You see.
having such a varicose vein. Previously, I don't know about it. So he expired due to heart attack.
There might be another reason for that heart attack. It's not only varicose vein. See how the things have been changed after injecting the sclerosing agent.
It's coming, you see.
See,
The white layer is coming.
Yeah. See, it just got whitish color. Yeah. That is what the sclerosing agent which is going inside. About, no, we have just below knee.